everyone, and welcome to the Physicians in Training podcast series. Today, we are joined by Dr. Christopher Jackson. Dr. Jackson is an assistant professor of medicine at the University of Tennessee Health Science Center, where he also serves as an associate program director of the internal medicine residency program. Dr. Jackson completed his internal medicine residency training and a year as chief resident at UT before joining as faculty. Thank you so much for joining us today, Dr. Jackson.
Thank you so much for having me, Julie. It's an awesome privilege and pleasure to be on the Physicians in Training podcast for the SMA.
I know for myself and a lot of listeners out there that we are really excited to hear about the other side of the match process. So would you mind telling us a little bit about your role, particularly in the residency program and the match process?
Absolutely. I serve as an associate program director with a focus on curriculum. So my central role outside of recruitment and other things is to figure out how to best train our internal medicine residents to be compassionate, evidence-based internists. Certainly, as a part of that is recruiting the best people possible to come and train with us here in Memphis. And so in that process, I have multiple roles. One role is I get a chance to review applications from students from across the United States, seeing all the wonderful and amazing things that they are doing and determining, who do we invite, to come and check out Memphis and check out our program. The second aspect is getting a chance to interview potential residents. And I would say of all the things, that's probably the most fun. Getting a chance to meet people and hear their stories and their passion for internal medicine, but also hear why coming to our training program in Memphis most aligns with their personal and or professional goals. And then the final part of my involvement with recruitment is looking at all of the applicants that we've interviewed and deciding at the end, who do we place on our rank lists at certain areas to determine who will be our, next incoming class of interns. And so it is a whirlwind process that is definitely a labor of love, but definitely something that we all enjoy and look forward to each year.
I'm really glad to hear that. It sounds like the program has a very holistic approach to reviewing applications. I'm sure every year you get a lot of very qualified applicants who are very enthusiastic about internal medicine. From your perspective, what do you think helps an applicant stand out during this process?
To take a minute and really reflect on that question, I think the first thing you identified is that there are so many qualified applicants. We won't be able to interview every single qualified applicant that puts in an application for our medicine residency program. And so the first thing I always remind applicants during the process is that even if you do not get that interview from the school that you just knew you were going to get an interview from, that's not a statement of your worth, your potential as a future resident. That is more a statement of just the limitations of the process itself. When I think of applications and how I, look, or how I view, who's going to be most successful, probably what you do outside of the classroom or outside of the walls of the hospital tells me a little bit more. I want to know that people are engaged in their community, because I believe not only here in Memphis, but in other places, we in academic medical centers have a role in improving the lives of the patients in our community. And so when I look at applications and see that, potential residents are, very engaged in community work and advocacy, be it, being involved with student-run free clinics, or be it involved with, providing basic necessities of life to those that do not have the same means. That kind of others-focused mindset, I think, really speaks to not only who we are as a program, but who I'm looking for as a physician. I think most programs would say that if they just wanted everybody that scored a certain step one, a certain step two score, they could easily make a filter and put all all the applicants that had those scores in interviews and say that's it. But that's not the only thing. You're more than your scores, you're more than your grades. You know, your process of going into residency is a part of a journey. And I get curious about the journey. What have been the highs of your journey, and why do you think those are the highs? And the lows of your journey, not focusing on them, but how did you respond to those lows, and how have they helped empower you or make you better as you are applying to residency? So those are a few things that I consider, at least in terms of overall, application. Certainly research comes up a lot, and I get asked, well, how much research do I need? Can I get into residency if I absolutely don't have an interest in research or have not done research? And I would say overall, I've never seen research be a negative part of anyone's application. Certainly the skills needed to start, maintain and finish a research project, the persistence, the focus on a goal, the getting the final product, those skills are not just important in research, but also important in training. And so when I do see applicants that have research on their profile, I do look at it as a positive that, not only in the clinical setting or in the classroom you've done well, but also you've extended that to interests outside of the clinical area. However, in the same way, if you are involved in a lot of advocacy work or other things that fill your cup or make you feel self-actualized as a future physician in training, we also find that valuable. And the absence of research does not necessarily mean that you cannot be competitive and or cannot match in the program of your interest.
And can you tell us a little bit more about the interview season itself and what that process is like for your program?
For application season, generally we start receiving applications at the end of September, early October. From that point, we convene a group of faculty members and other program personnel to review applications, after which we will start giving invitations for interviews, usually by mid to late October. I think in the past couple of years, we've had anywhere 3,000, 4,000 applications to look through. And so part of what we do is we try to look for those, aspects, qualities that make us feel that, you're going to not only be a good fit for internal medicine, but a good fit for our program. So for us, that's thinking of things like, being others focused, do you have an interest in working with underserved, communities, particularly like ours here in Memphis? What was your clinical, what did your clinical performance look like? So looking at your letters of recommendation and looking at your overall grades from your clerkships. And then based off of our holistic review, we say, this person looks like they would be a great candidate. We will extend an offer for an interview. Or sometimes we'll say, maybe this person will be a good fit. We won't say no definitively yet. We'll come back and review later. Or we'll say, for a multitude of reasons, this person may not be the best fit, and not to say that you wouldn't be a good fit other places, but just maybe not the best fit for us. And we might say, well, no, we do not offer the interview in that case. So that's where the season starts. And then usually somewhere either in kind of late September, we will start the process of, finalizing interviews, and between September and October, interviews start. And it is a mad dash. This year, we did interviews all through Zoom. We did them as a half day where we would have a welcome from our program director, kind of allowing incoming residents to meet our chief residents, and then followed by 2 faculty interviews of approximately 20 minutes duration, followed by kind of a wrap-up session with our chiefs and with our residents. And I will say that I appreciated that, having Zoom and having virtual capabilities probably allowed us to be able to, connect with individuals and residents that we would not have connected with otherwise. But certainly, I don't think there's any substitute for being in person and really getting a chance to interact and engage with people in that particular setting. So when we finish those interviews, we convene every week and we look at the applicants that we interviewed that week and decide, how strongly do we feel about this applicant? Is this applicant the one we absolutely want? Like kind of making what we call a rolling rank list. And we do that all throughout the interview season. Until the very end, after the last interview, we look at the rank list and say, how do we feel with our rank list? Do we want to move somebody up? Do we want to keep somebody the same? What modifications do we want to make? So that's kind of a 50,000 foot view of the application season for us as a program.
Thank you so much for that really helpful response. I'm sure with the pandemic this year and last year, you had to make a lot of different changes to the residency application process. And can you talk a little bit about some of the advantages and disadvantages to the changes that occurred this year, for example, virtual interviews and things like that?
The major advantage that we felt was for the applicants. I remember being a medical student and I remember not really appreciating the high cost associated with applying to residency. I can say confidently that when I applied to internal medicine residency, I probably easily spent over $5,000, $6,000 to apply. And recognizing that, often medical students are, receiving loans and not necessarily gainfully employed, or medical students are, receiving loans and not gainfully employed, that can be a significant barrier for people being able to, go and explore programs. And so being able to kind of potentially decrease those, opportunity costs, I think is a wonderful thing that has happened during the pandemic. And I hope that even beyond the pandemic, that we'll at least consider keeping some sort of virtual option as a way of hopefully, making the process more equitable for all involved. That being said, I think the disadvantages are, it's hard to show all of the wonderful aspects of your program virtually. Certainly, I say that the strongest part of our program is the camaraderie amongst our residents, as well as their relationships with us as faculty. And while some of those things can be seen on the screen, it's a lot easier to see those in person. And so while I appreciate the advantages from an equity standpoint, the disadvantage of really not being able to get the full picture is one that we definitely had to negotiate with a lot during the interview season. But overall, I think that we managed okay. But looking forward, that would be something to think about as programs like ours and others are considering, like, how will we do this in the future?
And do you think there will be any permanent changes that may have occurred during COVID-19 to the application process that you think will continue into the future?
Good question. And I'll be honest, there are ideas I have. I don't know yet what those permanent changes would be. Certainly, I think a lot of us have thought, well, while virtual interviews may not be the funnest thing we've ever done, is it a mechanism to allow more equal access? It might be. And certainly thinking about then, how can we incorporate that into a recruitment strategy going forward would be an important thing that we learned from this COVID-19, pandemic. I think also we'll be more intentional with our recruitment efforts when people join us back in person. And so now when I think of, well, what matters most to incoming residents regarding our program, like, yes, I would love for them to come and sit in on an ambulatory report that we do, or yes, I would love to make sure they have tons of FaceTime with faculty, but overwhelmingly, it is having more and more time with residents and being able to ask those questions of what is your experience like? What are the highs? What are the lows? Like how did you come to the decision that this was the place for you to come to train? And really highlighting that even more in recruitment for this upcoming season is a change that I suspect all of us will think a little bit more
I had mentioned a little bit earlier about the rank list and the rolling rank list. Can you talk a little bit about what the process is like for when programs are determining their rank list? And is that a static thing, or are there factors that are considered after the interview and so on that could result in changes to the rank list?
Absolutely. This is such an important question. I think one undervalued thing from the applicant perspective is the whole interview day probably ranks among the highest things we consider when making the rank list. And so, yes, having a certain score, step one, step two, having certain letters, all of those are important to get you in the door. But in terms of what we remember most, it's the actual interview day. And so just making sure that you bring your full self to the interview day and really in whatever way you feel comfortable showing us your full self and making sure we know about your passion for medicine. Why do you want to come to this particular program instead of the hundreds of other internal medicine residency programs in the country? And then making sure that all of your interactions that day are the best they possibly can be. It is interesting, I would say. I remember some interactions on the interview season where it just seemed like people were not putting their best foot forward. And even with very good grades and even with very good letters of recommendation, one of the easiest things I saw that changed the rank list was, a very good or not so good interaction on the interview day. So that's one thing. In terms of how we create the list in general, thinking about holistic review, it's, thinking about all those parts of your application. So, coming up with, well, how important do we feel about your extracurricular experiences, your overall general app review, the passion that you described for being in the specialty. If you've done any research in that specialty, why did you do it and why did you think it was important? Those are among some of the things that we factor into the rank list. But again, the top thing is actually the interview day itself. What did our residents think of you as a future colleague? What did the attendings think of you as someone that we would likely teach in the future? What did the program director, think of you when they had their session with you, either one-on-one or in a group? And then an underappreciated part is the program coordinator. So the program coordinator is the one that usually sends your interview invitation. They're the ones that'll be communicating with you before the interview and communicating with you afterwards. And so make sure you treat that program coordinator with the utmost respect and kindness. I think a very easy way to go down on a rank list is to treat the program coordinator poorly. And you would think it would go without saying, but unfortunately, those things happen. And so I just go back to just remember the rules, your parents taught you, when you're coming on interview day, make sure, again, you're being your best self, minding your manners, and making sure that you are treating everybody, irrespective of what you think or their role may be or not, with the utmost respect and kindness.
Absolutely. And I think that is a good rule to follow for the entirety of your medical training. So, in addition to the pandemic, there are a lot of other changes that are coming, with step one being changed to pass fail, and then step two, CS, being eliminated. How do you think those changes will affect the application process?
Absolutely. I think the first thing will be that there will probably be more focus on step two, CK. And while we all recognize the inherent limitations of standardized exams and the inherent biases that are in said exams. If with step one being pass fail, it will likely put more emphasis on step two CK. And I think that as incoming resident, that is something to keep in mind as you're preparing, because that might be the thing that, again, get your foot in the door. And so that's number one. I think number two, it will matter how much your clinical experiences on the wards are communicated through in your letters and in your medical student performance evaluation, or your MSPE. Those will probably become a lot more important because, again, when you have so many applications, a lot of what we do is looking for what things are standard no matter what medical school you go to. And the things that will be most standard will likely be CK, MSPEs, for example. I think the last thing that will really come into play is there has been some talks of whether or not there will be kind of limitations on applications in the future. How far those will go, I'm not sure. But I do think people will have to become a little bit more picky and choosy about, what places they're going to apply to or not. Recognizing that, again, with limitations, knowing that, people can only interview so many folks, how do you make sure that you match up and line up with the number of programs that's best for you to ensure that you have a successful match at the end?
Thank you so much for that really informative answer. Do you have any thoughts about how medical students can keep themselves sane during the stress of the application process and the interview process?
I would first say that know that even on our side, we do understand the inherent stress of this process. And I can definitely attest from my own experience of the anxiety of waiting for the next email from ARIS to say whether or not a program was going to offer me an interview. The first thing I would say is recognize that all programs kind of usually give interviews in waves, so to speak. So just know that just because you don't hear from a program in the first week doesn't mean that the opportunity to interview at that program is gone. As I said, having multiple applications, you would be surprised just by the number of things we're trying to balance, to determine who are the best applicants to interview for the program. So that's the first thing, is as hard as it is, just knowing that, you might not get that instantaneous response. And it doesn't mean that we don't want you to be in our program. It just may mean that we need a little bit more time. The second thing that I think is important is if you are getting further along in the interview season and you haven't heard from a program that you're interested in, I certainly think it is okay and reasonable to reach out to that, program. Now, certain programs may feel differently about that. And so I would say before you do that, certainly go on their website and make sure that they don't say something like, please don't, email or call us before, we send you an email offering you an interview. But I think most places welcome an email just saying, I'm really interested in your program. And I would say if you do that, just make sure that you're highlighting why it's that particular program. So just sending an email saying, I'm interested in your program because you train us in internal medicine. We appreciate that, but that doesn't actually tell me why you're interested in the University of Tennessee, Memphis, because you could get wonderful internal medicine training all across the United States. But if you told me I'm really interested in Memphis because you all have a county-based hospital that does a lot of work, treating patients who are living with HIV. And I really want more experience treating that patient population because where I am currently, I don't have that. That tells me a lot more and probably would go a lot longer of a way when I am reviewing an application to say, hey, maybe we should give this person an opportunity. I think a third thing during the interview process is, as you're going to different schools, take 5 minutes at the end of the interview day and write down one thing you liked and one thing you didn't. And the real reason to do this is because you will see, as the interview process goes on, a lot of programs are going to look very similar. They have a similar amount of residents. There is some structure to doing didactics. There's, so many, experiences in the clinic or on the wards, that if you don't have those differentiating factors for you, it can be hard to tease out at the end, what place do I really like versus what place maybe did I not like as much as I expected. And then the final thing I would say is, recognize that it's going to be a journey and enjoy the journey. I know that it's hard to go through a whole process and wait till March to find out where you're going to go for the next 2, 3, or however many years of your life. But there are some important aspects on the journey too, of just finding out what you care about and what you're most passionate about for the program that you choose to go to. I met colleagues along the way during the interview season that end up becoming friends. There's so much more to the journey of becoming a doctor and going through the interview season than just, what's my final destination. And talk to friends and colleagues about the stresses you feel. It is a stressful process, and I know that it's easy for me now, being on the other side of this process, and being now almost 7 years from when I did it originally. But keeping all of that in mind, your friends going through the process with you can be a great source of support. And I think you should make time and space to connect with them and just acknowledge, like, oh my goodness, I can't believe we haven't heard back, from, this program, or, I'm nervous about this. And the same, reach out to your faculty at your institution if you have concerns, either that you haven't heard from a program, or that, I just don't know if I'm doing all the things I need to make sure that I have a successful match at the end.
Thank you so much for all of that very helpful advice on the application process, Dr. Jackson. For myself, and I'm sure for a lot of the listeners out there who may be getting closer to applying for residency or applying this fall, all of this advice is extremely helpful. I'd love to hear a little bit more about your role as the director of the educational program at UT. Can you tell us a little bit more about that part of your daily responsibilities?
I say that I have one of the coolest jobs in the world. And so I identify as a clinician educator. So I'm a clinician first. So 80% of my time during the week is spent doing just that, taking great care of patients alongside of my residents, but even by myself. And so as an outpatient doctor, that translates to about 6 or 7 half days a week of doing just clinical work. The remaining kind of 3 half days of the week, it gets very interesting for me in that I get a chance to do educational things, I also get a chance to do a little bit of research, and also do some administrative duties. On the educational front, that looks like, for example, getting a chance to attend morning report and kind of do teaching with my residents, about various topics in hospital and outpatient-based management of certain conditions. That also looks like, doing scheduled didactics with, my interns on important ambulatory medicine topics. And that usually occurs on Wednesday mornings. And that also looks like doing dedicated didactic sessions with my residents, which is on Thursday afternoons, about ambulatory topics. But the nice part of my schedule is that no week really looks the same. I can have a week of, using my research and educational time to record podcasts such as this one, or, getting a chance to have a research meeting with, my research team, and we're looking at, how to do, evidence-based reviews of various topics, or, I'm having a meeting, teaching residents how to be better educators, or preparing residents to be, preparing interns to be supervisors. So my schedule never actually looks the same. And for me, that's great because it means that no week ever is boring. I always have something that is going on that makes, things interesting.
For other physicians out there who may be interested in getting involved in the administrative or educational side of academic medicine, can you talk a little bit about the steps you took to shape your role to what it is today?
Thank you so much for this question, Julia. And I will say that the journey is still ongoing. And so one thing I would advise is that it never really stops. When I was a resident, I knew that I enjoyed teaching, whether that was teaching at the bedside with, my, interns or fellow residents, on a complicated case, or presenting a morning report, or, doing a, didactic session with my medical students that were a part of our team. I just enjoyed teaching. And so the first thing I tried to do was, as multiple times as I could, find opportunities to teach. And when I found those opportunities, to make sure that I asked for feedback. How can I make this better? What did you appreciate about this session? What did you not appreciate? And so I think for those that are kind of interested in being clinician educators, it's just like any other muscle. You have to flex it. And so working it out by, educating, teaching is so important. Some programs have clinician educator tracks, even, whether it's dermatology, internal medicine, et cetera. And so if you are interested, I think letting your program director, know that's something that you're interested in, and seeing if they can connect you with a program like that that's already going on at your institution, or maybe outside of your institution. And for me, that was one of the principal reasons I ended up doing a chief residency year, because I knew that I wanted to refine my skills as an educator. I knew I wanted to spend a little bit more time starting to develop my own interest in research projects and, kind of curriculum development. And so it started when I was a chief resident. And my job at that time was to revamp our, noon conference curricula, and, getting a chance to go through that process of like curriculum mapping and figuring out how we can do this better. And then figuring out a way to measure to see whether or not I achieved that was great. And then finally, at now 2 years into my role, is continuously seeking professional development. So right now I'm a part of the Society of General Internal Medicine's TEACH program, which is for educators in general internal medicine to really refine their skills as clinician educators. There are programs outside of it in other disciplines as well, but finding ways to, again, get that additional training, I think is very important if you're considering, kind of an educator role in the future.
From your perspective, what are some topics that are very important or especially relevant during residency training currently?
I think growth mindset is probably a big one. What is an underappreciated aspect of residency and training in general is that accepting that you're not where you need to be yet, but that you're on a process of getting there is important. And so part of training, I feel, is being able to go from having a more fixed mindset, oh, I messed up on this case, or I messed up on this, in training exam, and saying, well, no, I'm on a journey to become a, evidence-based, compassionate, patient-centered physician in whatever discipline I'm in. And so because of that, there are always opportunities along the way to grow. And so even from a in-training exam score or a not so great patient encounter, figuring out, well, what were the specific things that didn't go well with that, and making a improvement plan to get to where you want to get to. I think that is a underappreciated lesson and an underappreciated thing that, we think is important, and we think it is vital for an intern or a resident to know. I think another underappreciated thing is how you synthesize knowledge. No matter what your discipline is, I think it's underappreciated that you have to tackle a lot of information. And you had to do the same thing in medical school, but now you're doing it kind of in real time as you're taking care of the people that need you to use this information. And so really thinking about how do I organize information, and not only how I organize it, but then how do I recall it when I need it, becomes very important. And then the other important thing I think is, feedback, being able to both give good feedback, but also receive feedback. One of my colleagues here talks about radical candor, and being able to know that, feedback is one of the best things we can give to a colleague, or that we can receive from a colleague, that indicates that they care. Because the only way all of us get better is through feedback. And so being able to know how that's done, how it's done well, I think is important.
Definitely. I think those are important traits for any trainee to have, no matter what field or specialty you go into. And do you think that your involvement in education has impacted your role as a clinician in any way?
I am a infinitely better clinician because I'm an educator. I say that my residents challenge me to stay up to date. And not only to stay up to date, but to know the rationale for why I'm doing something. So my residents and I have kind of an agreement that when we're discussing a management plan, and if I'm proposing something and I can't explain why I'm proposing it, that we go back to the drawing board. Because ideally, the whole goal is that we're working on a team to be able to take the best care of the patient. And in doing that, part of the knowledge or the recognition of where we are is that I should be able to explain my reasoning to you and say, this is why I feel we should go with this management plan over another. And if I can't, maybe that means that there's a part of my knowledge that either needs to be refreshed, or I need to start from scratch. And the same thing with my residents, not necessarily focusing on you're right or you're wrong, but focusing on, well, what made you choose that particular strategy in this case versus another? And then helping you through the use of questioning and through the use of guiding to say, like, okay, well, when I see this case in clinic, I'll use this strategy in these scenarios versus I'll use this strategy in these scenarios. So when I think of how, my, clinician development has been helped by being an educator, it really is in having these rich discussions with colleagues and with residents who have made me think, what is the why behind what I do? And is that why, evidence-based? But not only is it evidence-based, but am I considering, the important patient factors too? And I think we as clinician educators kind of have a unique and awesome opportunity there, to really leverage education to be a primer for continuous evidence-based practice, improvement.
And lastly, from your perspective, what do you think are some of the traits that you've noticed that help a resident succeed during training?
I have thought about this a lot because this question comes up from my residents a lot. The most important things I think are, one, to be curious. When I was a kid, I remember my parents saying, I always had to ask why, and I always had to know, the nitty gritty of things. And I think that curiosity serves you well, no matter what your discipline of medicine is. Get to the why, not just the what. It's very easy, for example, for me to say a patient is not taking their medicine. What is more challenging and probably is more meaningful is the why behind that. whether that's new stressors at home, whether that's inability to afford medications and I need to change things, whether that's they had concerns about the management plan that because I didn't ask before, I didn't know, and therefore that's why they didn't feel comfortable with this plan of care. It's getting to the why. And so I try to teach my residents to be curious. Why are you doing something? And if you can't really articulate why, then going to the literature, going to primary sources and trying to find that answer, because that not only helps you know things better, it also improves the care you're going to give to that patient and the patients that will come after. So that's the first, is to be curious. I think the second is to desire feedback. And I think there's a big distinction here between feedback and compliments. We all want to be told we're doing a good job. And I do think that positive reinforcing feedback has a role. But much like if you only ate sweets at dinner, or if you only had a certain type of food, you might be missing the other nutrients you need. And in a similar way, you need constructive feedback to get better. Now, that feedback should be grounded in helping you improve. It should not be malicious in intent. But if you're not getting constructive feedback to get better, then you might not have the same growth and development that you would just by getting positive compliments or reinforcing feedback only. So really, really, asking the hard questions. One of my residents will say, Dr. Jackson, don't just tell me that I'm good. Tell me how I can be better. And it's really reframed how I think about feedback when that resident asked me that. The last thing I would say is studying doesn't stop once you leave medical school. I still read 30 minutes to an hour every day about my patients. And I learned that from one of my attendings on the ID service in medical school. Said you should always be reading, even if it's something small, because medicine is about lifelong learning. And it can get very easy to get on autopilot. And so if you're not constantly reading, refreshing things, you might not be picking up on new advances. And you could very easily, be it unintentional, be practicing things that are relatively out of date. And so whether it's an article, whether it's, listening to a podcast, whether it's looking at a blog, I try to make sure that at least 30 minutes out of the day, I'm doing that, because that makes me reflect and think about my patients, and it's going to make me think about my practice. And then I take it a step further and I chat with my colleagues about it. I have come into clinic sometimes with my residents and say, hey, did you see the new lung cancer screening guidelines? And they're like, what lung cancer screening guidelines? And we have a wonderful discussion about it. I have a topic planned for today when I go in and talk to them with the recent ACP clinical practice guideline paper that came out on yesterday. But, making sure you embrace lifelong learning and make that an active part of your daily routine, I think is quite important. So those are a few things that I think are key for residents.
Thank you so much for that very helpful and informative discussion, Dr. Jackson. With that, I'll wrap up. Do you have any last parting words for our listeners out there?
First, I would say, know that you are enough. By virtue of you getting into medical school and going through all the parts of training and navigating this in the midst of a global pandemic, know that you are enough, and you should be applauded for training and thriving in that environment. Number two, one thing that has helped me now more than ever, and shout out to Dr. Kimberly Manning and Dr. Grace Wong from a Core IM podcast where they spoke about this, is think about your mission statement. So they define that mission statement for an educator as saying, I want to work with this group of learners teaching this particular topic towards affecting this outcome. And the purpose of that mission statement is just making sure that if you have that mission statement, you always have a North Star. And so as you're thinking about new opportunities or thinking about, your next steps forward, thinking about, well, what's my mission? Is this tied to my mission or not? Can help you from, kind of getting overload from all the wonderful things that, kind of come your way as opportunities. And then the final thing is find multiple mentors. My development as a clinician educator, as a researcher, as a person has been highly dependent on having wonderful, wonderful mentors that have pushed me and that have, shown me opportunities that I would have never considered. And so I would shout out my wonderful mentors, Dr. Danny Zipkin, ambulatory educator over at Duke, Dr. Kimberly Manning, a traditional internist doing both outpatient and inpatient internal medicine at Emory University, and so many others. But make sure you have a team of mentors who have your best interest at heart and who will push you to consider and reach for the stars, so that you can realize all the dreams that you desire.
Thank you so much for taking the time to speak to us on these very important topics, Dr. Jackson. For all of our listeners, thank you so much for tuning in, and see you at the next Physicians in Training podcast.